Hi, welcome to the next mentorship moment. I'm Dr. Reagan, and today we have Dr. Kevin Sprouse. He's a osteopath. He's also board certified in emergency medicine through his training in a residency in New York City, as well as board certified in sports medicine through South Carolina, Greenville with, let's see, I want to say it correctly, Steadman Hawkins Clinic in Greenville, South Carolina. He owns a practice here in Knoxville, Tennessee called Podium Sports Medicine, where he works with a lot of elite athletes, as well as some executives and some folks that are really uniquely skilled in performance and taking care of their own health. He's been a physician for professional cyclists and teams in Europe, and really have a pleasure and honor of knowing him in my community. Kevin, thank you so much for joining us.
Thanks. It's great to be here. I'm excited to talk to y'all today.
So Kevin, tell us a little bit, our students, our mentees and mentors, about the importance of developing a professional network.
I mean, so it's a broad question, but I think one that is incredibly important as you develop your kind of professional environment that you work in. It was first really made apparent to me during my training. So you mentioned I did my training at Steadman Hawkins in Greenville, South Carolina. And that facility was kind of headed up by Rich Hawkins, who is a world-renowned orthopedic surgeon. And we would get people who flew in from certainly all over the country, but all over the world to see him and to see the other specialists there. There's a robust training network as well. So training orthopedic surgeon fellows, training primary care sports medicine fellows like myself, and training physical therapy fellows as well. And so very much of an academic focus woven into the day in the clinic. And one of the things that stuck out to me was that within this big clinic, there was always someone to go ask when you had a question. And this wasn't limited to the people who were training there. The guys who were publishing papers, patenting surgical devices, the top of their career basically would very frequently walk down the hall, get somebody else and ask a question, right? And sometimes they would get us, the fellows. They'd say, hey, go get Sprouse, ask him to come in here, which was both terrifying and humbling and everything else when you're learning to do this. But the impression it left on me was that it's so important to have that network of trusted people to reach out to and get an opinion, whether that opinion is clinical or academic, more esoteric, or judging the literature, or just looking at an image, MRI or CAT scan, X-ray. And so when I left that training program, I became aware that that doesn't happen by accident. That setup was incredibly unique. And when you get out and practice, all of a sudden you don't have those resources readily available. So you have to create them. One of the nice things that we had through Steadman Hawkins was a formal network across the country and even across the world that we could tap into. And so I was working at the time and still working professional cycling. And I remember having an athlete who crashed on his bike in Belgium, had a fairly complicated clavicle fracture. And I was trying to figure out where to get him for the best care, the surgical, how do we find somebody? And I went back to this Steadman Hawkins network, and it turns out that there was a guy in Belgium who had come and done a training fellowship in South Carolina. And so I was put in touch with him. He's upper extremity, actually focused on the clavicle. And 12 hours later, we had this athlete in the hands of an amazing specialist in Belgium, all because of this clinical network, right? And so that made it even more apparent to me that developing this was going to be something I had to do within my practice. Fast forward 12 years now, and what I've tried to create is very much that, but in an informal manner. So if I have a patient who needs help with cardiology or orthopedics or whatever it may be, and they are located in California or Boston or Europe, then I kind of know who to go to get them that care, or to say, hey, who do you know in X city, right? And where that's been incredibly helpful to me is with physical therapy, because working with elite athletes, sometimes you need a surgeon, sometimes you need a physician to kind of lay hands, make the diagnosis, maybe do injections, maybe a surgery is warranted, but almost always you need help returning them from the injury to performance. And where a lot of times with non-elite athletes or non-athletes, you can get them there a little more easily because the bar is maybe a bit lower. In my opinion, maybe that's not quite a fair statement, but the tables are turned with elite athletes to the point that that therapeutic intervention is key to whether they ever come back to the level that they were at, and certainly how quickly they get there. And so for me, yes, it's having cardiologists, it's having orthopedists, but having that physical therapy network, physios in Europe or physical therapists here in the US, where I can get them to somebody trusted who I know is going to be able to deal with the personality, to deal with the expectations, to address them in a way that that's cooperative, right? That kind of furthers the goal that I have for them, or we have the conversation to redirect that goal. But I know that they're not getting other ideas, and that there's a constant collaboration. It goes so far in the success of that athlete, which honestly makes me look good, right? But also just serves that athlete to get back to where they need to be as quickly as possible. And so any professional, physician, physical therapist coming out of school, I think is presented with that same problem, whether they recognize it or not. Some people, I think, choose to drop into the whatever framework there is where they're hired to work. And oftentimes, I'd say more often than not, that's probably a subpar framework. It's kind of like, well, here's the resources we have. If we don't have it, you just kind of tell the patient they should maybe go talk to somebody in this field and let them loose. Not wrong, but not very supportive and unlikely to result in a good outcome for the patient. And so I would really urge physical therapy students coming out into practice and early in practice to nourish that network, to really go out and spend the time meeting other PTs, people that may be seen as competitors, right? Because the competitive network, or the competitive paradigm, is set up by the practices and the people who are paying the bills and all those things. And that stuff has to get done. But in reality, you're gonna see patients, they're gonna come to you that are not within your wheelhouse, not perfectly a fit for you. And it's gonna be much better for you to say, hey, this person down the street or across town is excellent at what you need, and I'm gonna set you up with them. And what'll happen on the flip side is they'll see people and say, you know what, this person down the street, and send somebody else to you. You'll have people to bounce ideas off of locally. And as you go to conferences and any chance that you have to have interaction with people statewide, nationally, you build that even further, so that when you see those patients that you don't quite know what to do with, or you're a little unsure, you've got the phone a friend, right? You can pick up the phone or send an email and say, hey, here's what I'm dealing with. How can you help? And if you don't develop that, at the end of the day, you end up with a patient that gets potentially not the outcome that they could have had. And you end up with an academic progression that is stagnated. So everybody loses, right? So I guess it's a long way of pointing out that the academic network, or the professional network that you set up around yourself, it really falls to you to do it, and to the degree that you give that attention and nourishment, you'll benefit from it. Your patients will, And it's really a foundational component of a good practice, but it's one that you're not taught to do. It really just kind of falls to you to do it.
Yeah, I agree, Kevin. Such great insights. I think that as a leader, it's our responsibility to rise the tide for everyone. And I think that's what I've, admired and appreciated about your practice here in Knoxville and abroad, is that we've known each other for over, 6 years or so. And being able to see, the way that you intentionally refer clients to different providers, including therapy providers for different purposes, something I've really admired about your medical practice, and that it rises the tide for everyone, not just for your practice, but I think it challenges everyone in the healthcare community to go, maybe I should be a bit more respectful of what I am good at and what others are good at, and that referring someone, even within the therapy community, if it's something else that that needs to be done for that patient, is the right thing for the patient. And I think we all need to be reminded about that on a regular basis.
Yeah, well, thank you. And I think, recognizing that people have things that they're good at doesn't mean they're bad at other things, but if they really specialize in something, if I'm seeing a runner, I've got physical therapists in town who I know do really well with runners. Maybe they're runners themselves. And so they have an interest and they also have an expertise, and it just lines up well for the patient. If I'm seeing a cyclist or if I'm seeing an overhead athlete, and having those specific people to send them to doesn't mean the others aren't any good. It just means that, hey, between this athlete's problem and their personality, I think they're going to do really well with this therapist or this other doc. I'll send people for other treatments I don't do, or sometimes things I do, but I think that somebody else is going to be a better fit for them, whether that's personality wise or expertise. And so it's, I think it's an important part of practice, recognizing, kind of putting the pride away and recognizing what's going to be best for that patient. And also having fun with a wide network that you can send folks to and learn from. It's just, at the end of the day, I think it's a more fun way to practice, quite honestly.
Kevin, thank you for sharing your humility and your candor.
Thank you. My pleasure.